helping patients to determine, what size breast implants are going to work best for their body is one of the big things that we focus on in the initial consult. So how we achieve that is I examine their breast tissue, examine their skin quality, and then I take biodimensional measurements from their sternal notch to their nipple, from their clavicle to their nipple, as well as the width of their breast. So all these help inform the decision as well as the thickness of their skin. And that kind of informs, position of the implant, meaning is it going to be in front of the muscle, is it going to be behind the muscle? Typically we'll place implants behind the muscle, and then, incision, location, we discuss that as well. Once we have these measurements, we're then able to recommend a selection of implants that may work best for that size. There's different profiles of the implants, and they vary from a slightly wider implant to a higher profile implant where there's more volume anteriorly to posteriorly. And then we have the patients try on implant sizers, which are provided by the implant company, and they kind of give patients a good idea. We have them put on a sports bra, and then they are able to see kind of what this additional volume will look like with clothing. Then, using the pictures that we take during the consultation, we're able to generate a 3D simulation of what the different size implants would look like. And so the patients then get an email with that information so they can, look back at that and then not feel pressured to make that decision that day. The discussions we have as far as implant size is kind of a jumping off point. It's not set in stone until kind of the final pre-op appointment. So they have the ability to make changes and, think about it a little bit.